This is a gel port. So this is our only investment. This is very special, cutting edge technology. We're able to give them the best treatment. It is a matter of pride that we brought it to our country as well. Thank you so much for taking the time out to listen to us and share with us our happiness and pride in this achievement of ours. It gives me great pride here today to stand in front of all of you and talk about the first endoscopic mastectomy that's been done in the country. And it's fantastic, and we feel really happy that we are able to bring in this innovative technique which is centered on a patient-centric approach to all of you. And this is not just a personal achievement. This is an achievement for the organization Apollo, and also an achievement for the country, where we believe in making everything available for our citizen in the country itself, and to close the care gap and ensure that everyone gets equitable treatment. So as we all know, breast cancer is the commonest cancer in the world, and it is alarming to know that the rates of breast cancer is increasing at 0.5% every year. But there has been tremendous improvement and advances in the diagnosis and management of breast cancer over the last 3 to 4 decades, and it continues as I speak. Every day there's a new guideline, and every day there is a new advancement that comes, which we ensure that we make available to the patients we treat. So gone are the days when we use such grotesque methods of chopping off the breast or burning the breast for somebody who's been affected with cancer. Today, the highlight is on conservation of the breast. It is on conservation. It is on saving the organ rather than removing it. But in breast cancer care, we have gone a step forward. We believe in not just saving the organ, but ensuring that it looks exactly the way it was before we had operated. And that is made evident by the pre and post-op pictures in this patient, who's another patient, not the patient we're discussing today, where you can see that pre and post-operatively it looks the same. So breast conservation, as we know, it helps to improve the body image of a woman, helps instill confidence and improve psychosocial outcomes. The emphasis today is beyond just cancer cure, and we're moving towards improving the patient's quality of life. 50% of the patients who present to us today present in advanced or locally advanced stages. So there are those women who still require removal of the breast. Now, what do we do for such women where we cannot conserve? So in this case, we try to reconstruct the breast, or we do what is called conservative mastectomy. So conservative mastectomy is where we conserve the skin and the nipple of the breast. So it's either a skin sparing mastectomy or a nipple sparing mastectomy, and then we reconstruct it using implants or the patient's own body tissues. So this is the picture of a breast, and when I talk about a conservative mastectomy, what we have done today for our patient using the innovative and the novel endoscopic approach is where we retain the skin of the breast, and we remove the glandular tissue, including the tumor. We try to save the skin and the nipple areolar complex. For patients where the nipple shows evidence of tumor, we have to excise the nipple as well. If the skin is involved, we remove the skin as well. But traditional minimal access breast surgery, nipple sparing mastectomy, if you see, you use incisions like this over the breast, right? So once it heals leaving behind a scar. And that is what we're trying to avoid. A breast is a very important organ for a woman, contributes to her confidence, her psychosocial scores as well. And that is where minimal access breast surgery comes into the picture. So this has developed over the last 2 decades, and we use methods to achieve the same oncological safe surgical margins as in conventional cancer surgery, but with smaller incisions, fewer incisions. And we use specialized surgical instruments to give better visualization of the operative field while keeping the incision very small and hidden in inconspicuous areas. So if you see from the previous slide, these are the kind of incisions that are put on the breast. If you can see in this picture, the incision is taken in the lateral mammary crease, which remains well hidden. And when we talk about minimal access breast surgery, it is any approach or any instrument, any technology that helps you achieve this. It can be robotic, but in this case, we have introduced a very novel technique called the endoscopic approach. The advantages of endoscopic breast surgery is that the incisions are small, they're very well hidden. It has shorter post-operative recovery, offers excellent cosmesis, and preserves the body image of the patient. In patients with cancer, it helps us remove the cancer as well, and there's improved patient as well as surgeon satisfaction. The indications for endoscopic nipple-sparing mastectomy are 2. Either in patients without a cancer, right? But those who are at high risk for developing the cancer, be it because of genetic mutations or a very strong family history, they have to undergo what we call a prophylactic mastectomy. So in such women, we can utilize this technique. In patients with cancer, we can consider it in those with very early breast cancer, smaller tumors, and hopefully without skin involvement. But you must remember that the selection criteria for any surgery with regard to breast cancer, be it conservation or be it minimal access breast surgery, the selection criteria is very stringent, and this decision has to be taken after a close discussion with the cancer surgeon. So coming to our patient who underwent this technique, she's a 46-year-old lady diagnosed with an early breast cancer. The nipple did not seem to be involved on the mammogram and MRI extensive breast imaging. However, she was not suitable for a breast conservation, which is why we had planned her for removal of the breast, or what we scientifically call modified radical mastectomy. And I'm so happy here to say that this lady, who's a homemaker, was very, very keen on reconstruction, and she demanded it, in fact, and said, you know, I care about my body image. So we decided to go ahead with an endoscopic nipple-sparing mastectomy for her, and we have already seen the advantages. I've discussed it in the previous slide. Now, why did I choose the endoscopic technique? One, because I can perform this procedure without using special or expensive equipment. The instrumentation is already available in the operation theater, and by this I mean not just our operation theater in Apollo where we have everything available to us, but any hospital in the country with the basic instruments, they can go ahead with this technique. It has very good applicability and reproducibility in all hospitals in India without requiring large investments, and it assures the best and the latest advanced treatment for all our citizens. They don't really have to leave the country, go elsewhere to get the latest technology or the latest treatment now. And I think that is what makes it special. You know, it's a matter of pride for us that we were able to bring this technique into the country. And this is the first time an endoscopic mastectomy has been performed in India. It has not been performed prior to this. The endoscopic, and I say endoscopic mastectomy here because that is what we have done for this patient. But by this means, you can also do a breast conservation, you can address the axilla, etc. So I'm going to go into this description of the surgery. There are some images here. I'm just giving you all fair warning in case anyone's maybe disturbed by blood or vivid imagery. So this is where I've put this video up to show you the incision that we take. So a traditional nipple sparing mastectomy would mean I would take an incision around the entire lateral aspect. But if you can see, I have just marked a 3.5 to 4 centimeter in the lateral mammary crease. And then we create a pocket. We open up the incision, we create a pocket, and we place, a polythene bag, which is, it's not your regular polythene bag. It's a specialized one made for medical use, and which is used to attach to the port. It helps create the tunnel for us to put our instruments inside to go ahead with this procedure. And this is a gel port that we have used in order to enable this. And this is how we're doing the procedure. So, in traditional nipple sparing mastectomy, I would be standing. We would have taken a very, very long incision. There would be, retractors put inside the breast, stretching the skin very uncomfortably and hampering the blood supply. But in this, if you see very comfortably, we're sitting and we have the instruments and we're watching the dissection. We're watching the television and performing the dissection. So, again, another speciality of this technique is usually endoscopy or laparoscopy is something that is done for abdominal surgery, where the abdominal cavity is very big and you have a lot of space to put in the instruments. But the breast, if you see, is a very contained organ and we have very limited space, and that too we go in only through a 3.5 or 4 centimeter incision. But this is how, putting in these instruments, going inside, we get adequate visualization to go in and do this surgery. And this is the final specimen which we have removed the entire breast through that 3.5-4 centimeter incision. And as with any nipple sparing or skin sparing mastectomy, once the breast gland is removed, we must reconstruct it using either silicone implants or the patient's own body tissues. So in this case, we did an autologous whole breast reconstruction using the tissue from the patient's abdomen. So the patient was very, very happy, and it's a brilliant feeling after a major surgery. You walk into the recovery and she's smiling at you and she says thank you. To introduce something new to the country is not possible without the wholesome support of the entire team. Surgical as well as the admin and the management. Not just introduce the best technology to the citizens of our country, but to ensure that it reaches the common man. So thank you very much. Thank you.